Um, can you see the screen?
Yes.
Okay, perfect. Okay, and just double checking, were you able to forward the Google Drive link I sent you regarding the Google Forms?
Yes, sir, we have that link. Should we share it with the participants right now?
You guys can share it, yeah, so that they can. I like did like some like small like practice sessions in between, so you guys can get some hands-on experience. So if you can share it, that will be great. And then I will start
Okay,
in
sir.
like a minute.
Okay, sir. I'll share it. I'll share it.
Okay, so let me know when to start. I will start at that time. Okay, no worries.
Sir, we have shared the form.
Okay, perfect. And I can start now, or you want to wait for like 1-2 more minutes for people to join?
Sir, you can start right now.
Okay, perfect. So, so my topic of presentation is Beginner's Guide to Narrative Review. I'm going to go step by step on how to write narrative review, and in between, I will also like touch on different other articles you can write as a medical student. And a lot of journals actually do have like a special discount, and sometimes they completely waive off fee for medical students as well. And they're really like good impact factor journals too. So even if you guys are writing narrative review, you can easily like BMC and BMJ. Sometimes they do give like a option for medical students from developing countries to uh, don't pay the fee or anything for their clinical articles. So what is a narrative review? It's a literature review is a type of research article published in a professional peer-reviewed journal. The purpose of the literature review is to basically summarize the knowledge on the current topic, and then the author basically gives a summary on a specific part of that topic. The purpose of the literature review is to provide the reader with a comprehensive overview and put all the information into the perspective the reader wants to see. So, for example, if you are like talking about like treatment of dengue in Africa. So the review article will be focused more towards the initial part will be focused on how what is dengue and the epidemiology and everything, but the major chunk of the article will be on the treatment part and what are the different challenges different health systems faced and how they counter that. And the purpose is that the reader should be able to read your article and should get all the information so that he doesn't have to read 20, 30, or 40 different articles on the same topic. And basically, it's a compilation from different research and designs, and you put them together and then present it in a way that it's like reader friendly. So the character of an effective review is basically you should have a clear objective of why you're writing the review article, um, and there should be a clear purpose as well. So for example, like when COVID came, if you're writing a review article on COVID, it will be kind of hard. But for example, if you focus on like the role of certain medication in ICU for COVID patients, then you will be able to do a much better job at the review article. So your topic should be focused, and there should be reason why you're writing it. Um, their structure is also like most of the review articles, they have a similar structure. So we'll go over that in the following slides. And the main purpose of review articles also to bring a fresh perspective. So, for example, like if you're writing a COVID article and they're like drug A, B, C, and D, uh, when you're writing a review article, you can also like discuss about like different challenges different countries will face if they are trying to start the patient on the same medication. And you can also like focus your review article on that treatment options and how they do in different race and ethnicity. For example, like drug A might work better in African American, drug B might work better in Asian. So you can focus on that part. So you just focus on a very small part of that topic, and that way you'll be able to review all the articles, and then you don't have to like do like 200, 300, or 400 like articles for that one particular review article. It should benefit the reader, and it should add new point to existing literature. So when you're ever writing a review article, just make sure you have these 6 points in mind. So this was one of the article I wrote during my medical school. At that time, there was an Ebola pandemic in the Africa, and we wrote an Ebola the killer virus review article. Um, in this article, I briefly mentioned regarding the epidemiology, the incidence, prior outbreak of Ebola virus, but the main chunk of the article was basically focused on different measures communities can take in order to contain Ebola virus and in order to treat Ebola virus more effectively. And then keeping that in mind, I basically focus on articles which are dealing more with like how the public health system response was, how the private health system response was, how the community hospitals helped in containing the Ebola virus. And so the main chunk of the article was basically focused on that one particular topic regarding Ebola virus. And that way you can like guide your review article towards a specific direction. If you try to write an article just on Ebola virus, it becomes very long, and you won't be able to cover every single thing in detail. So choosing a topic is very important, and then sometimes timings also matter. For example, like later on there was an outbreak on Zika virus, and we wrote a review article on that. The only thing is like if you're writing an article on epidemics and if you're really fast about it, for example, if the epidemic started in March and you're able to complete your review article by like April or May, you will have a very good chance in publishing your article in a very good journal. So timing is also important, and then choosing the topic also matters a lot if you are going to write an article regarding some infectious diseases. Because later on, after like 6 to 7 or like 12 months, more people will start writing review article on that topic, and then it becomes like really hard to get it published. So starting with the first subtopic, developing research skills. So formulating a clear research question is really important. Like I said before, mention about recent development in the field of medicine. That can be a purpose of your review article. You can also talk about a new disease. Like for example, you can write an article about monkeypox, and you can focus about the recent advancement or new diagnostic techniques for that specific topic. You can also resolve a debate. So for example, if there is an article regarding that, should PPI be used in ICU or not, and what should be the duration of PPI? So you can do a review article. You can search like different articles or randomized controlled trials done on this topic on PubMed. And then based on the findings of your review article, you can say, okay, we reviewed 100 papers. 70 of them were saying that there is a definite benefit of oral PPI when they're giving in ICU on ventilated patients, and 30 articles were saying there is no definite benefit. So you can like resolve a debate and give a concise answer to that question, or you can just answer a specific question if somebody has. So for example, a lot of new COVID medication came in recent time. A lot of new IBD medications are coming, and then you can just write a review article on that one particular medication, and you can say that whether this drug is effective or not. And ethnicity and race is always like a very good topic to write a review article on, because each drug does not act the same way in different population. So you can always do like a review article of that drug in different population and to see if it was effective in all of them or not. And then before you start writing a review article, just write like in 1 or 2 lines what will be the main question of the review article. And if you are going to be the reader, or if you are looking for like review articles, what will you look in that review article? And then each review article will have secondary questions, which I will go over it in the next few slides. So if you are able to answer these 2 questions, and if you're able to answer them effectively, then you will be able to write a really good review article. So the first question will be, what will your article add to the existing literature? That's number one. And what is your topic of focus? So always start with the main topic and then try to go as detailed as you can. The review article doesn't have to cover everything about that specific topic as long as you have a direct question. So for example, if you are writing a review article on IBD medication, you don't have to write review, mention all the IBD medication. You can just focus on that one medication you're trying to work on. So for example, like in the abstract I shared earlier in the slide, our objective was that in this review article, we summarize the pathogenesis of Ebola virus disease and the factor that led to its spread. We also highlight intervention employed by certain countries that have successfully limited the epidemic and add a few preventive measures after studying the current data. So you can also suggest additional measures which you gain from other articles, and you can mention them in your review article. Or for example, you see patients during your different rotations, and for example, you see a lot of diabetic patients, and you identify that a lot of diabetic patients have uncontrolled diabetes because they're not adherent to the medication. And you're writing a review article, you can give your own clinical opinion as well on that topic based on your own current practices. So once you have the topic in mind, the second thing is to have an effective search strategy to figure out how you're going to extract the articles from PubMed. So you want to decide what kind of articles you're searching. So for example, if you're going to write a review article on, for example, comparing should oral PPI be used in vent patients in ICU? So you want to pick up randomized control trials. If you're writing in journal about Zika virus or Ebola virus or monkeypox or COVID or HIV, so that patient, for that population, you can pick any kind of article you want. But if you're writing about drugs, or if you're writing about some new treatment modalities, you want to focus on randomized control trials because they are basically the highest quality papers that are out there, and you don't have to focus on the case controls which are unrandomized or stuff like that. So you can ignore them, just focus on the randomized control trial. But if you're writing an article which is more preventive or treatment related, you can do case control cohort studies which are not randomized control trial. So picking the article is really important. So when I was writing the Ebola virus, there was no randomized control trial. All of them were basically different community experience regarding their containment of Ebola virus. So that's why we didn't have the randomized control trial filter in our PubMed search. So study or design or level of evidence is basically, if you're going to take case reports, they are the lowest level of evidence. And if you're going to take randomized control trial, they are the highest level of evidence. And then you want to identify your primary outcome. So for example, if I'm looking at PPI invent, if the patient had any GI bleeding later on, that will be my primary outcome. And secondary outcome can be regarding that if there was any effect on the length of stay, if they were getting PPI, or did they get any other infections such as C. diff after using PPI in the ICU. Databases, there are a lot of databases. I'm going to mention them in one of the following slides, but for beginners, I think it's better to use PubMed. One, I think it's very easy to search. You can easily put filters on. For example, if you want to search papers from 1960 till now, you can easily do that on PubMed. You can also click on which kind of paper you want to review. So for example, if I'm writing a review on a medication, I will just click randomized control trial and it will just bring up all the RCTs. And then keywords are also very easy to pick up on PubMed. And then the fourth advantage I will explain when we go over the reference section is that PubMed basically gives you the reference in the proper format the journal wants. You don't have to manually do it. So that's why I usually use PubMed if I'm writing a review article. And I used to do the same thing when I was a medical student. Then regional papers are also important. So for example, if you're trying to write a paper which will have impact on people on Pakistan, then you should also incorporate regional papers in your review, and then you should mention them in your article. And like I said, PubMed can be a good source for review. So this is the first practice session. So basically, it's regarding impact of COVID-19 or GI tract, a clinical review. And if you guys can click on the link and let me know if your link is working.
Sir, the link that you shared with me through email.
Yes, that yeah, the same link. If you guys click on the link in the email, it should go.
Yeah, yes, sir. That link is working. I have shared that in both the WhatsApp group and in the chat in this meeting also.
Okay, perfect. So the first practice session question is make a skeletal structure on this topic. So I will give you guys like 5 to 10 minutes. You guys can type in your answers, and then we'll discuss it.
The link for the practice session.
They should have emailed you the link for the practice session. If you open it, the first question is the one which we're going to address.
Ira, I have sent the link in the WhatsApp group also, and if you open the chat box for the Google Meet, I've just sent the link over here also.
Okay, thank you.
And if you guys have any questions in between, do you guys can like interrupt me and ask me at that time as well.
I understand what we're supposed to do.
So basically, like just in your like so far, like what you have gained, you try to make a skeletal structure on the topic on the given topic. So basically, you want to write how you're going to write the clinical review on this particular topic and what will you be your subheadings be. So for example, for Ebola virus, the first heading was incidence. The second one was like epidemiology. Third one was material and method. And then I focused more on like preventive measures and vaccines. So you can like do something similar for this topic so you guys can get some practice on it.
Okay, thank you.
Okay, so I'm going to continue, and then once all the questions are done, you guys can submit the form. They're going to be total of 5 questions. So, and at the end, we'll just go over the answer you guys have submitted. The response doesn't collect your name, so I should be just getting your answers. Okay, so what to do when you are searching for articles? So the first thing is the first search should include a quick review of articles, baseline knowledge about the topic. Once you have an understanding of the topic, identify which area there are limited or no review articles on. So this is the most important stuff. So um, before you start writing a review article, you want to make sure there's very limited article, or if there are some review articles, maybe you want to focus on that area of that topic where there's like limited research and limited review article, and then you will have a better chance of getting that topic published. The initial part of your review will focus on the introduction. So basically, it could be like 4 to 5, or it can be like 10 lines long paragraph regarding the introduction of the topic, and then you want to link the introduction to your main purpose of the review article. The major chunk of your review article should be focused on the topic you are going to write on and not on the epidemiology or the basic of that disease. Making a skeletal structure of the topic your review article is going to cover is very important. So this is what you guys did just now. And then you want to take note on the selected studies and make changes if you need to after your review article, like after you've done reviewing the article on your skeletal structure. So for example, if you wrote a skeletal structure, but then you read an article which mentions about like the role of like vaccine or like role of like immunoglobulin vaccine combination, which was not previously discussed, so you didn't know about it, then you can add that in your skeletal structure. So you make a skeletal structure after your initial review, and then once you have done a deep review, you can always modify your skeletal structure and then take it from there. So regarding the previous question, like the first section question, so for if you're going to write an article about COVID on the GI tract, you can have two different approaches. The first approach is you can do like a systemic based approach in which you can start from impact of COVID on esophagus, stomach, and then you can make the way down. The other approach is you can focus regarding COVID medications which have an impact on GI tract. You can also write a review article on that. The review article I wrote basically focus on regarding what are the underlying GI conditions which can cause you to have a bad or severe COVID infection. And then the second part of the article basically focus about actual effect of COVID on the GI tract. So we went from organ to organ. And the last part of the review article, you should try to include like what are the future developments or future treatment options which are undergoing like clinical trials, so that they're also incorporated in your review article, and that will get you a lot of citations later on down the line. So always try to have a future perspective or a future drugs in development, something like that at the end of the review article, and because that way your article will remain relevant for a much longer time. And you will keep on getting citations. Citations usually take time once you have published the article, but you get more citations on review article because it's a nice summary of the pathology or the disease, and then people are more likely to read review articles than read like 40, 50 original articles on that topic. So making an outline is important. So you outline the main points, which you guys just state on question 1. Use headings and subheadings. And if you're using subheading, make sure that the subheading under a heading are related to that heading. So for example, when for our article on COVID, we basically focus on like impact of different underlying GI condition that can make COVID, like make the COVID infection worse or can increase the morbidity or mortality associated with COVID, or was as risk factors for the COVID infection. And then we went, the subheadings are basically that specific diseases one by one. So coming to my first article, Ebola the killer virus. So what we did was we wrote the introduction, and the introduction was basically focused on the incidence, the prevalence, recent changes in the trend, and why talking about the Ebola virus disease at that time was important, and why it has such a high morbidity and mortality rate. The second part of the article was basically our like one line of the purpose of the review article, which basically showed that like because of the high morbidity and mortality, it's very important to have good preventive measures as well as treatment measures for the Ebola disease. The second subheading was methodology. Then we mentioned briefly regarding what is Ebola virus, how it's transmitted, clinical symptom of Ebola virus, and how is it diagnosed. This was the third part of the review article. It was not very like comprehensive, but it allowed the reviewers to get just the basic information regarding what is Ebola virus and what's going on with it. The key part of our article was how to prevent the spread. So if you read this review article, you'll see that most of the article is basically focused on preventing the spread of the Ebola virus. And then the last part was basically conclusion. So most of your review article will follow this similar format. Writing the introduction is the most important part of your review article, because a lot of reviewers will read your introduction and make a decision that should they read your article further or not, and then is this article worth publishing. So focusing on introduction is very important, and you want your introduction to be more eventually focus on your primary objective of the review article. So the introduction basically establishes the reason of the review. You will state the purpose of the review article and its importance. And you want to keep it short because if it's very long, even if it's like a journal reviewer, they will lose the interest in this topic. Or if it's a reader, then he will just, it will be hard for him to like read a very long introduction. So you want to keep the introduction short, focused, and when you're writing the introduction, your goal should be to link it with your purpose of the review article. And then once you're done writing the introduction, you can always have a second and third look. And when you're looking the second time, try to see the introduction as like you were reading it for somebody else's article, and what are the positive and the negative things in the introduction, so you can improve it. Most of the reviewers, they are like different physicians, they're working in different hospitals, and sometimes they don't have enough time to actually read your article in full detail. So you want to make sure you have the key points highlighted so it's easy for them to assess if it's important to get your article published. So writing the introduction is, I think, the most important part of the article after methodology. So understanding the structure of a review article, so objective, background that you will address in the introduction. Methodology is really important, and based on how you're writing the review article, your review article can either be a clinical review article, and then once you gain some more experiences, you guys will be able to write meta-analysis. They are more complicated, and but meta-analysis are also like, they are kind of like a clinical review article, but they're more structured, and there is an inclusion and exclusion criteria. Discussion is basically where you focus your main review article and what are your findings and how you summarize them, and in the conclusion and the keywords. These are the main headings your review article will have, regardless of which journal you are submitting the article. Keywords are also very important for two reasons. First of them, because if you have the right keywords, people are trying to find articles on PubMed. The PubMed basically identify articles based on keywords. So having the right keywords, which you submit to the journal after your article is published, is very important. And then second, you will also use similar keywords for your methodology section, because you have to tell the journal that how you found those articles. So they will ask you which keywords you used. So if somebody else was trying to do the same thing, they should be able to reproduce what you did. Understanding the basic is very important. So reasons to read review articles: provide physicians with a quick summary of the topic, provides information for decision makers, provides an unbiased summary of different articles, and avoid pitfalls in previous research. So this is really important because you're reviewing different articles and it's not your own research. There is less conflict of interest. And that's why a lot of people actually prefer reading review articles, because it's a summary, and then the person who's writing it does not have any like vested interest in that topic by itself. So there's less conflict of interest. It also provides readers with insight into dynamics, understanding the finding of other studies in an easier manner. And depending on the quality of the paper, review article can provide a very high level of evidence for making clinical practice decisions. This is especially true in topics which have very limited papers on. And if you did a really good job in the review article, a lot of guidelines and a lot of like original articles will cite your review article. So that's very important to make sure you use high quality paper in writing review articles. One of the questions that author must take when writing a review article is to reduce the bias. So when you start writing the review article, make sure you don't have any bias towards that topic. And when you're doing your like literature review, try to include both positive and negative aspects of that article, of that topic or medication, so you can address both of them. And then I have a separate section later on as well, but main thing is to avoid plagiarism. It's a very big thing, and if the journals find out that you have plagiarized them, they might like ban you, or plagiarism itself has a lot of like impact down the line as well. So you want to make sure you avoid plagiarism. It's more important in clinical review article, because when you're doing original research, your article basically is focused on your own results, and your result, and based on your result, you're writing in your own word at what you found out. But in clinical review article, you're already trying to put a summary from other people's article. So when you're doing that, make sure you're not copy pasting it or paraphrasing it. Both of them do count as like plagiarism, and sometimes the journals, they have the software which they can detect if the three words were like just like switched around, and they go by 333 words, so they are able to detect plagiarism, which the online free softwares might not be able to. So avoiding plagiarism is really important, and we'll go over that in the end of the presentation too. Any questions so
I
far?
have a question. Yes. From what I know before, you can write LTEs as well on topics that are like, um, if you want to address a new topic uh, that has come up recently. For example, I was going to write an LTE on Ozempic, the diabetic medication, uh,
Mm-hmm.
and I got to know that when I'm writing an LTE, it's better to have an experienced author or an experienced physician that has already published in a journal. So I think that makes your chances of getting published higher. Is that true in this case as well? And do you need a physician who has already published in a reputable journal for you to be able to publish it? Because we are as medical students, I don't think it's like we don't have that much knowledge to publish a clinical review directly about a new topic that has come up in the field of medicine, etc.
So it's a good question. Most of the journals, when you submit an article, they will always like one of the author either to be like a practicing physician, and especially on from the same field of medicine as well. So if you're trying to like even if you're writing it like an article as students, when you submit it, they will always will ask them like one of the author has to be an expert on that field, or at least practicing in that field. It's not necessary for the author to publish. For example, like when we wrote Ebola virus, like I don't think so anybody of us had published on that topic. But because if you have somebody who's dealing with different infectious diseases such as HIV or other kind of like diseases, then that person can write an article on like different infectious disease. So it's not necessary for that person who's supervising you to have published exactly on that topic, but they should be from the same field. So for example, I wrote an article regarding like review article on diabetes. Then one of my like supervising attending at that time was an endocrinologist. So it's very important to have a supervising physician from the same field. And for example, if you're writing an review article on cardiology, and if you submit it, the journal will also ask that like we need one person who at least has done some specialization in cardiology, so that they are able to double check your work before it's submitted. So it's important to have one person from the same field, and that does increase the chance of getting it published. But it's not necessary that person has to publish something on that topic.
Okay, thank you. One more thing, if I can ask, how how is a review different from a letter to an editor? Like, I think they have the same, like, there is a type of letter to editor where you address new issues or something, and new info that you can, if there's like some new information that has come up about a disease or something, I isn't that the same as a review? I'm
Um,
confused with it.
so that's another good question. So review article, they are most. So if you look at the different guidelines from different journal, um, letter to editor is usually smaller. Um, the review article is much longer and it has like a proper structure. Letter to the editor is mostly unstructured. Most journals you can write letter to the editor based on um, an article which was already published in that journal. So there are two kind of letter to editor. One of them is invited. So for example, like you're doing a lot of research on Ozempic, then one of the journal might email you that, is it possible for you to write a letter to the editor regarding recent advances or recent like side effects you guys have noticed when you were using Ozempic. So that is one kind of letter to editor. Second, when you can do it as like medical student is that, for example, they published an article regarding the role of GLP agonist and its impact on peri-endoscopic management. So you write a read a original article, then you can write a letter to editor highlighting one aspect of that article that like the ACG guidelines, they were recommending that if you should hold GLP agonist 1 week before but there have been some recent development in which if somebody is on a clear liquid diet the day before the procedure, they can um, undergo the procedure without using the GLP agonist. So a letter to the editor will focus basically on a response to that specific article. But a letter to editor on a completely new topic, uninvited, will be less likely to get published. So
Okay,
if you
thank
look
you.
at if you look at like NEGM and most of the journals, they have letter to the editor, basically, which is citing the original article. So, for example, if they publish an article regarding this new drug, the letter to the editor is basically focused on that drug. Or, for example, if they publish an article regarding like dengue, you can give your perspective from like a dengue outbreak in Pakistan and write it to for that specific article. But letter to editor, they are much faster, they're easier to write. But at the same time, if it's an invited letter to the editor, it's going to get accepted faster. If it's not an invited one, then it might take some time, but it is possible. And it's you don't need a lot of reference. I think most of them have like 5 to 10 reference limit as well when you're writing letter to the editor. But definitely you can try it. I know GPMA, they do accept letter to the editor, so you can start from there and then you can like aim for different journals. But I know GPMA, they used to accept letter to editor and it's PubMed index as well. So that's another good way of increasing your.
तो मैंने पॉपकॉर्न खाने थे हाँ
आयरा
मैंने salt
आपका माइक अनम्यूट है, आप उसको प्लीज म्यूट करें.
Okay. But yeah, those who are really.
Can you repeat what you said about GPMA? I lost your my number.
So for GPMA, like I know they do have a letter to editors section. So if you, for example, comment on one of their article, you can start your like maybe your first letter to editor could be to JPMA, and they can like help you format it as well. And the changes they recommend, once you make it, it's more likely to get published there. Once you have one letter to the editor published, it's more easier to publish in different journals. So maybe you can look at different articles which are published on JPMA, and then if you find something on one of that article, you can write a letter to the editor, and then if it's accepted, then you can try another journal. And once you have like a good publication number, a lot of journals will be more keen of accepting your paper. But it's a good way to start letter to editor by submitting it to JPMA. But higher impact journals, it's a bit harder to get your letter to editor accepted unless you are an expert in that field. Okay, so continuing forward. So foundational understanding of narrative review methodology is really important. The method section should describe the study in a step-by-step fashion. You should mention the search engine which you guys use. If you mention PubMed, it's more than enough. Keywords are really important. And you want to mention the time range from which time to which time you search the articles and what was your criteria for publication. Like, did you choose article from 2000 till date, or did you choose article from 1900, or whatever you put in the inclusion exclusion criteria? That's very important. Number of articles yielded from the search and number of articles selected from the study is really important for some journals. So they will ask you that, like, when you use your keywords, time range, inclusion exclusion criteria, how many articles came out and how many were eventually selected. So for example, like you came out with 160 articles, but 40 of them had like conflict of interest, or the methodology was not good, or it didn't actually answer your they didn't have any like material on the topic you are focusing on, then they are excluded. And you mention how many articles you selected for the study. So this is practice session 2. If you guys click on the same link, or if it's open, then basically in this session you want to outline the methodology for the topic impact of COVID-19 on GI tract. So for example, if you're writing the methodology section, try to write it by answering these like 7-8 bullet points. And I can give you guys like 5 to 10 minutes, and then we'll continue from the next slide. So you want to mention the PubMed, which keyword you will use for this article, what will be the time range, in your opinion, what should be the inclusion and exclusion criteria, and then which articles you will not include in your final study. Okay, we'll go to the next slide. So this slide is really important. I will email my presentation as well once I'm like after this, once we are done. But if you have like addressed these 4 or 5 points in any like methodology section, you should be able to get it accepted in any journal regardless of their impact factor. So the key thing that author needs to ask him or herself is, can the reader replicate the search using the criteria outlined in your methodology? So this is something which your journals will ask you as well, that if they were to use the same keywords, search engine, inclusion and exclusion criteria will be able to get the same articles you got. So that's why it's very important to mention every single keyword you used on the PubMed in order to extract the articles. So this is for the Ebola virus. This is one of my initial reviews. I think this was the first review article, the second review article I wrote, and I was still learning. But it did mention all the key things which the journal was looking for. So we mentioned regarding like the main topic was basically epidemiology, transmission, clinical manifestation, diagnosis, and prevention of Ebola virus. We used Medline and Google Scholar. Keywords we used at that time was Ebola virus. We highlight like we did like we mentioned all the keywords which we used on the PubMed when we're doing the search or on the Google Scholar. And we mentioned articles we took from 1976 to 2015. In the introduction section, we had mentioned that was the first time the first Ebola virus article was published. So that's why we used that duration. And we reviewed the articles from November 2015 to March 2015. And the total articles which were yielded from our research was 174. And out of which 52 were included in the study. So if you mention this line in any review article you are writing, it should be okay with most of the journals. Some journals do ask more about inclusion and exclusion criteria, but some journals they're not very pertinent about it. Coming to the critical analysis and the synthesis part of the review article, this is a very short question. Basically, is asking that if you were the reader reading your like review article on this topic, what will you focus on? Why would you read that review article? So, and that's really important. First, because the journals will also want you to, some journals will ask you that why should the reader read your review article, or what is the main key points, or highlight the 3 points of your review article. And second, later down, if your review article is well structured, it has a lot of figures and table, and it's addressing the exact topic, you are more likely to get citations. Number of citations play a role like later down in your career, but it takes time for citations to happen, because if you publish an article now, if somebody is reading it, they might take like 6 months to 2 years to write like an article, and then once that's published, you will get 1 citation. So citation takes time. In order to increase your citation, you want to make sure there's a table. There's a lot of different softwares which you can use to make diagrams, but don't copy paste it from Google, because they're all copyright. And then if you're unable to make diagrams, even if you make tables, that's more than good enough to increase your citation. So when you start reading a review article, or if you're like searching on Google, you will see a lot of patient-oriented versus disease-oriented evidence. Patient-oriented articles, basically, they're more focused on patients' morbidity, quality of life, or mortality. Drug-oriented articles, they're more focused on lab values or other measures of response. In your initial phase, when you're writing a clinical review article, it's better to write an article patient-oriented than disease-oriented, because it's going to get more likely to be accepted, and second, it will have more like practical implications. You will get most likely more citations. Drug-oriented evidence, it's a bit harder to write those review articles. We need more randomized controlled trial, and then thirdly, you might need some experience using that drug, so you can address like you can give your own perspective as well. For patient-oriented, it's much easier to give your own perspective, because you guys see patients in different rotations. And patient-oriented, you can focus more about a certain patient population or patient age group, or certain community you can focus on. So it's more easy to write patient-oriented clinical review articles. This is like a quick summary regarding level A, B, and C. These are the different evidence levels which are available. So level A is basically randomized controlled trial, high quality meta-analysis. So these are two are like the main level A evidence, and most of the guidelines, if you guys read, are going to be using level A evidence, and they will be able to make strong recommendation, moderate recommendation, and low recommendation. Level B, they are more clinical trials, but they were not randomized studies. They could be case control, cohort studies, lower quality randomized control trial. So they become level B. And level C is basically viewpoint, expert opinion, such as like clinical review article will by itself will become level C evidence. Case reports, case series, short communications to journal, they're all under level C quality. So you don't want to use level C when you're writing your own review article. And another thing is, so for example, if you're writing a review article on a topic which you don't you have some knowledge, but you think that your knowledge is not sufficient, it's always good to go to that. Like for example, if you want to write an article on gastroenterology related topic, you can always go to ACG guidelines. They're like available free on Google, and you can just read a quick guideline summary on that topic. That will definitely increase your knowledge regarding the topic, and it will make the review article easy. Same way, like there's like a cardiology guidelines, there's medicine guidelines on ACP. So it's always good to quickly read the guidelines on the topic you're going to write a review article on, and then it will make things much easier for you. So master the art of synthesis, use table and figure, that's the key thing. Because at the end of the day, most of the people, when they're even doing their own, like you guys are rounding and the attending asks you a question that, okay, like what do you think is the role of this medication in this patient population or this patient disease? Even if you quickly search on PubMed, you're more likely to look at tables and figures than to read the entire article. So if somebody has mentioned tables or figures, or they have like if patient is taking this drug, they are 92%, like they are like 9 times higher to have this disease as compared to the other population. You're more likely to just make your like recommendation based on that fact. And even if you're writing a review article, or when you start writing original studies, you will notice that you are more likely to cite papers which had good tables and figures, which make it easy for you to understand what they were talking about. Writing a review article is not only about extracting relevant previous work and analyzing them, but also making them more concise, summarized, and you have to be able to make conclusion from all the papers that have been published, and that is going to be on your own words. Providing an objective interpretation of the results and guiding readers for better understanding of the current evidence should form the central part of the discussion. Whenever there is not enough evidence to make objective conclusion, the lack of evidence should be stated as well. This is really important. So, for example, if you're writing a review article on like IBD medications, and some of them, they are still in phase 2 and phase 3 trial, and there's very limited literature available on them, it's better to state that, that the medication is still in development. We don't have phase 4 studies done on this topic, and so it's very hard to comment on long-term complications. So nowadays there's like a push to develop drugs for fatty liver, and there's a lot of different clinical trials going on, but we just have one medication which is recently approved, but all of them are not approved for fatty liver. So when you're writing a review article on like NASH, you can mention this fact as well, that all the results, or the review article is basically focused on the current level of evidence, and long-term complications or long-term side effects or long-term results from this medication is still lacking. And when you're trying to write a review article, it's better to write a review article on which a lot of new medications or new diagnostic changes are coming. That way you'll be able to get more articles which are latest. And if you're reading the guidelines, or if you're reading like different narrative review on that topic, you'll be able to give your own opinion as well. So this was one of the study which we basically, it was an invited review, and they had asked us to write a review article on pathogenesis of hepatocellular carcinoma in patients with NASH. It used to be NASH, they recently changed it to metabolic dysfunction associated with hepatitis. It's not common in Pakistan, but in United States, UK, because of increase in obesity, it's becoming very prevalent. And long term, there has been some association with hepatocellular carcinoma. So we made this diagram to basically first summarize all the different pathogenesis which is involved in transition from MASH to HCC. And second, this will also improve your chance of getting your article accepted, because journals do like figures. And second, if anybody is reading the article, they're not going to read my 2-3 pages on the pathogenesis. They will just look at the figure, and the figure will basically summarize everything. So having everything summarized in a figure helps a lot for publication, and then later on for citation, it also helps a lot. This is the same study regarding different. So basically, what we did was we mentioned the first author's name, was the study randomized control or meta-analysis, number of participants in that study, what was the objective, and what were the outcomes. This is you can always do something like this as well. and add it into your review articles. The key thing is when you're doing this, make sure you use your own words and it's not copy paste. That's the most important thing. So you want to make sure everything is written in your own word and you want to summarize it. And then we give like appropriate reference. This also helps in increasing your citation because people are most likely to cite a paper which has all the studies compiled in one instead of doing like 50 or 40 citations because each journal has their limit of citations or references you can use. Some journals allow you to use up to 60. Some journals allow you to use up to like 120 or something like that. And very limited journals don't have any limit. So sometimes when there is a limit, even when I was a medical student, I used to find articles which I'm able to gain 2, 3 references. Instead of like quoting 2, 3 people, I can just quote one paper which summarizes everything. Because I know a lot of journals, they have like a fixed reference, like 45, 50 references, and you can use more than that. Or if you use more than that, then you have to pay extra or something like that. So it's always good to summarize. And the table has to be relevant to your own study. That's also very important. So coming to our paper, Ebola virus paper was focused more towards preventing the spread of Ebola virus disease. And the discussion focused on community and state level measures which can be taken to prevent the spread of Ebola virus disease. So that was the main purpose of our paper. And 80% of our discussion was basically on just that thing alone. And these are the review of papers which are going to be accepted. I know like one of my like first 2 or 3 papers it got rejected, like I think like 15, 16 journals or something like that. But each journal they were able to give me like points which I can make to improve my article. And in the end, I realized that like in order for your paper to get accepted, it has to have a clear objective, and then your paper should be focused on that objective alone. You don't have to focus on unnecessary like small things which you're not eventually addressing. Using primary and secondary sources. In the initial stage, it is better to use PubMed for searching articles. The search engine is easy. It's easy to cite the article. We do have other sources such as Google Scholar, Cochrane Collaboration Database, the Center for Research Sport, TRIP database. So there's a lot of other databases which you can use. But I think if you use PubMed in the initial days, it's good enough. And most of the like I would say like 99% of the articles on PubMed, they are belonging to like good journals who have good reputation. So um, the reviewers would not question the quality of papers you have selected if you had used PubMed. In Google Scholar, there are like a lot of like non-PubMed journals which do come on Google Scholar, and then if somebody is reading a review article and is going over the reference, they might question that this paper, the reference you have used, the paper is not very strong or shouldn't be used to write a review article. So I would say stick with PubMed. This is session number 4. So the role of imaging modalities of diagnosing dysphagia, clinical review, what images table you would like to include. So if you were writing a review article, you just mention the table heading or the image heading you would like to include in this review article. Or how you can approach is like, for example, if you are a medical student and your attending asks you that what are the different imaging modalities you can use to diagnose dysphagia, then if you're going to read a review article, what points or what tables you would like to have in that review article. So you can just mention in one line the tables or the images you would like. Okay. So this was one of the review article I think I wrote during my fellowship or residency, and basically included tables. The first table was etiology for oropharyngeal dysphagia, and then the second table basically, like the second part of this table addressed the etiology for esophageal dysphagia. So we made two different tables, and we basically summarized all the possible etiologies of the two different type of dysphagia. Then table 3, which was, I think, the core of the paper, was basically a comparison of different diagnostic imaging modalities. And how we decided to go about it was to mention the name of the procedure or the diagnostic imaging, what were the indications, and what were the advantages and what were the disadvantages of using that specific imaging modality, and in which kind of disease or in which kind of like oropharyngeal or esophageal dysphagia would this imaging modality be indicated. And we did it for like all the different imaging modalities we had included. So this is just a quick um, part of the table, which to give you guys an idea how you can use table in different articles. But definitely, if you guys use tables and figures, you will see that your article is more likely to get accepted as compared to somebody just wrote like a structured abstract, but there's no figures and image in it. So imaging and table makes a big difference. And then, of course, if somebody is trying to find different imaging modalities, advantages and disadvantages, it will be easier for them to read a table instead of reading like 6, 7, 8 pages on that same thing. And when you're writing the table, you want to summarize it as much as you can. And it should be detailed, but should not include unnecessary or extra information. So coming to the last part of this, writing in the revising part, keep your writing simple. Consider your audience. Choose your words carefully. That's really important. You don't want to, even if you use like simple regular English vocabulary, it's like good enough. There's a lot of like softwares available, such as Grammarly, which can check your grammar and correct it. I know a lot of people are using ChatGPT and AI. Don't use them when you're like writing a review article. You can use them to get an idea, but don't use them because a lot of journals will nowadays will ask you that if this article involved any AI help or anything like that, and then AI is, I think, kind of like considered as like plagiarism as well in some journals. I won't use it personally, but this is something which came recently. So try to avoid using artificial intelligence. And I know for our conferences, they do ask us if we used AI, but I think with time, the journals will also start asking the same thing. Revise and revise again if needed. You'll always get to have another pair of eyes go over your article before submitting. Using a structured format is really important. If you use a structured format, you're more likely to get your review article published. And then practice makes perfect, especially when you start writing articles. I know like the first 3 years for me, they were really hard. We had a lot of rejection from different journals. And then, but with each rejection, they do tell you that why they rejected the article, and then you can improve that article, and you can make the same changes in your future article. And once you get a hang of it, publishing article is not really hard, and it doesn't take a lot of time. And then it's always good to ask for feedback from your peers. And then even if a journal like rejects it, they do give a detailed feedback, and you can use the same feedback for your future articles as well. So don't get discouraged, and it takes time, but once you start publishing, then it gets much easier. And then after a certain time, if the journal know that you've published a lot, I think their scrutiny process also like goes down a bit. But the first few articles there, I think, in my experience, it's a learning curve, and once you have learned it, it becomes really easy. So this part is, I think, the most important part. When you're writing a clinical review article, ethical consideration and avoiding bias. So plagiarism basically means using somebody else's words or idea without properly crediting. This is less likely to happen because I think everybody will basically use the reference and the citation. So it's less likely to happen in the field of like medicine or academic paper, but it can still happen. So make sure you give proper citations when you're writing the clinical review article, and then the other thing, which is basically writing your own words. So how I used to go about is, like, for example, if I'm writing introduction and I know that my introduction is going to cover the incidence, prevalence, mortality or morbidity of that disease, then I will read all the review articles, all the original articles and all the studies done on that topic, and then I will try to summarize it in my own word. And for example, if I'm using an idea from another article, I will just use citation at that time. And I usually do, like, when I'm writing review article, I usually follow the same pattern for the entire article. So for example, if I go to the section regarding impact of COVID on esophagus, I will read all the articles on esophagus and COVID, and then I will try to summarize it in my own word. And for example, if there was an article which showed that, like, 10% of the patient who had COVID developed new onset gastroesophageal reflux, the risk factor, like the odds ratio was 10. You can use the number and then you can use the citation, but your words and everything will be on your own. Use your own words, but get the idea from the different articles which have been published on that topic. So that way you're less likely to have plagiarism. And then the other reason I do it is because if you go point by point, you don't have to read like 400 articles at one shot. You can just read like 10, 20 articles on that specific topic and write it. And then when you go to, like, for example, COVID and stomach, you read articles on COVID and stomach, and then you do that subsection. And then in the end, if you go to like COVID in new advances, you read that and then do that section. So if you do section one by one and do your literature review at that same time, I think in the end it does save time. There's a lot of different softwares which you can use for reference citing. And if you do manual citing, that's also fine as well. EndNote is really good. But if you don't have EndNote, then I used to like cite manually, and then I use the PubMed how to cite, copy paste it from there, and then you get the citation already in Vancouver style. I think I've included a slide for this. So, like, this was one of the recent papers which we published on GLP agonist. So if you type the topic of the article on PubMed and click it, this will open, and there's an action called cite. If you use the format NLM, they have 3 different formats. They have also like American format for American journals. They have slightly different format, but most of the journals, they use NLM format. You click on LLM and you can easily just copy paste it to your reference. You don't have to change anything in it. Initially I used to do like Vancouver style, but this one, it already comes in Vancouver style. So you don't have to double check or anything. And that's another reason, if you guys use PubMed, it's going to be much easier. So each channel has its own instruction on how to use reference and citation. Most common styles are APA style, Vancouver style, which is which you can get it from PubMed, AMA style, LM style. So all these styles which are available, PubMed does have an option. So as long as you click one of them, it will automatically convert it and you can use it. So that way you don't have to manually do it. So this is the last practice session. It has 2 questions, 5 and 6. The only reason to include this practice session is to see if you guys can make your own review article, and if you're able to make your own structure for that review article. I will give you guys 10 minutes for this part. The topic you can choose on your own, and then basically you try to include the heading and subheading. Let's from there.
astounding, sir.
Yes.
You given 10 minutes for what? For 10 minutes?
If you go to the forms, the last one has basically make a skeletal structure on the topic of your own choosing and mention the points in table and figure you will add in your clinical review. So you can choose your own topic on which you want to write a review article, and then you can make a structure based on what we discussed so far in the presentation.
Okay, thank you, sir.
Okay, so I did go over the responses you guys have submitted so far. Like all of you guys are like really good, interesting like topics, and I think you guys can easily write a review article. And then just mention, remember to mention to add tables and figures. That's really important. It's okay if review article takes time, but you want to make sure there is no plagiarism. Um, the review article covers all the important topics, all the important subtopics of your topic you have chosen, and then it addresses the question which you had in mind. Um, when it comes to selecting appropriate journals, there's a lot of different journals, but if, for example, if your article is more focused towards like impact on Pakistan, you want to submit to maybe JPMA, it's like Combat Index. It does have a good impact factor, and it would be a good journal to start. There's a lot of like free journals as well, such as like Curious. I think they do give some special discount to medical students. At least they used to give it whenever I was a medical student, so you can always try that. And then you can always like search, like for example, if you wrote a review article and you choose citation from a particular journal, like you realize that 6, 7, or 8 people were from the same journals, uh, you can just like submit your review article to that specific journal. That can also help. And the other thing is, so for example, if you wrote an article regarding monkeypox, you want to submit it to an ID journal, it's more likely to get accepted. Um, impact factor varies, like journals which are more than 4 or 5, it might be a bit harder to get your article accepted. But if you want, you can always start from there. They would give you good feedback if they don't accept it. And then using that feedback, you can submit it to a journal which has like a slightly lower impact factor. Um, In my personal opinion, impact factor does matter, but when you're starting your like research and your like scholarly activities, as long as the journal is PubMed, that's more than good enough. Avoid non-PubMed journals, but PubMed journals, even if it has lower impact factor, it doesn't really matter. First, because it's PubMed, so it means the journal quality is good, and second, it's more likely to get cited down the line. PubMed articles are more cited as compared to non-PubMed articles. And then with time, if you guys want to pursue like a career in academics or research, or it is something which you think you enjoy, then you will realize that like it will get easier getting your article accepted down the line as compared to your early days. And some journals, they do promote like medical students to submit the articles. So you can definitely try those journals. And then there are like different conferences as well. Like for gastroenterology, we have like ACG conference in which happens once a year. If you get your abstract accepted there, it will be published in their journal book, and that is also PubMed. So sometimes if you just submit like a poster to something to a conference, it can also come to PubMed as well. There's now like a push by a lot of different conferences, by different institutions to include their abstract book into PubMed, and that also counts as like a publication for if you guys are trying to pursue residency in the US, and even for your CV as well, it does count as a publication. Prepare for peer review and publication. So once you submit, each journal has their own policy. Some journals are much faster, some journals take time. Some journals can take up to 6 months as well. All the journals basically they require at least 2 to 3 different peer review. And once the journal has been peer reviewed, they will email it back to you they will ask you for changes. And the change when you're making the changes, make sure you highlight the changes you made. And most of the journals will ask you on which line and which page the change was made. And try to answer all the reviewer questions and try to make the changes. If, for example, if the reviewer asks you for like 10 or 15 changes, and if you make all of them, the article will be accepted. But if you say that, oh, we can't make this change or this is like not possible, then the reviewer might create problem down the line. Try to address all his question as much as you can, and even if you can't address it entirely, try to address like at least 50% or 25% of it. Sometimes they will also tell, okay, you guys didn't include, for example, if you're doing an original research, and they say, oh, you didn't include patients who were from this ethnicity, or you didn't include patients from this part of the country or something like that. You can always say, okay, like the point is valid and we'll include it as limitation of the paper, and that's fine as well. Each paper has its own limitation, and you can always mention in the limitation section. Thank you so much. If you guys have any questions, we can go over them one by one. I also went over your response. Most of you guys, I think, are like, in my opinion, are like ready to like start writing articles. All of you like did a really good job in identifying what to include in introduction, how the methodology should be, what tables to include, and even the last like 2% in which basically you guys have to choose your own topic. Most of you guys have like really good topics, and you also have like a really good idea on which tables to include. So in my opinion, I think you guys can start like writing your like review articles. Just mention, remember, introduction has to be concise and focused towards your purpose of your review article. Make sure your methodology is as detailed as possible, and then once you start writing it, your eventual goal should be to the question you are basically focusing on. So for example, if your focus is on like the impact of like AI or impact of this drug or anything like that, you want to make sure your major chunk of the article is focused on that. And then when you're doing review article, it's always good at the end to give your own opinion based on what you learned from all the different articles. And the last part will be the conclusion, in which basically you summarize everything. And once you start submitting, it's like some peer review, they are really nice. They give you very good comments. Some peer reviews, they are just like, they are very strict. And but just take it as a learning process, and then but I'm sure you guys will do great because all of you guys have like really good ideas, and you guys have like structured it really nicely as well. So I'm positive you guys will be like, publishing a lot of paper, and you'll do much better than I did in my medical school. So anybody has any questions?
Assalamualaikum, sir. I had a question. Yes, sir. I wanted to ask that there are other types of reviews as well, right? Like we have a systematic review as well. So if any kind of study has already been done, let's say a systematic review has been done on a topic, can we do a narrative review on the similar topic?
Yeah, you can do a narrative review, and then when you're doing the narrative review, you can focus on like the specific part of that narrative review, that why you're writing that narrative review. So, for example, um, like nowadays there's a lot of push for like this GLP agonist because a lot of people are using GLP agonist in like I think it's all over worldwide. The GLP agonist use has increased, and now there was a recent like case report on which basically they saw that like patients who are on GLP agonists, they're more likely to have gastric residue and can have an impact on anesthesia. So there's a lot of like original articles getting published on that topic. But maybe you can write a clinical review on like somebody's on GLP agonist and they are getting a procedure such as colonoscopy done, and you can read up all the articles which were done on this topic, and then you can say that like patients who are on clear liquid diet, maybe they can get GLP agonist or something like that. So for narrative review, you can focus on just one part of the topic which the other meta-analysis or the original articles have not addressed. Or you can, I think the better clinical review article example will be that a lot of procedures are being cancelled, and a lot of time the GLP agonist is held for 1 week and then the patient develops uncontrolled diabetes. So maybe you can write a review article on that. So you try to find a like topic which has not been discussed upon, and it for example GLP agonist. There's a lot of articles, but I don't think it's very limited articles on the impact of stopping GLP agonist at this time. So you can easily write a review article on that. So you just want to identify which area of the topic is lacking, and then you write your clinical article on that. So it's okay even if there are meta-analysis available on it.
Thank you, sir.
Anybody has any other questions? Okay, sounds good. So if you guys have anything, do let me know. And thank you so much. I tried to make it concise so you guys don't get tired. And but you guys did really great in the like all your topics and like all your answers. They were all really good and amazing.
So, Dr. Haider, at the end of this session, I would really like to thank you for this session. It was really amazing, and keeping in mind the fact that we have been hearing about you since our first years. So it was a treat to listen to you, especially about this topic, because narrative reviews have been always been very confusing to us, and they seem to be like a very big thing that we can't even think about, and it is something we as medical students cannot work upon. And the fact that you mentioned that you are working on narrative review while you used to go to Nurpur Shahan, and many of us right now are going through our community medicine rotation. So this gives us a lot of hope that we can also do these things, and in future also we'll be looking forward to collaborate with you, and we'll be looking forward to more such sessions in future also. It was really great to learn from you and to be mentored by you.
Thank you so much. And thank you so much for the time. I think somebody raised their hand. Right. Yeah. Thank you so much for the invitation, and thank you so much for the time. And I wish you all.
Someone asked a question in the chat, and they're asking some information about postdoctorate position in US.
Can we elaborate on the postdoctorate position actually? Like, is it after residency or?
Hasib, can you make your question a little bit more elaborate, sir? Before residency, they're asking about before
So there
residency.
are like some research positions which you can avail before residency. The only downside is like a lot of these positions you have to end up coming on a J1 research visa. Um, and once you come on a J1 research visa, if you get residency, you have to convert it into J1 clinical. Um, I know like one of my friends who had the similar thing. He came on a J1 research and then he went into J1 clinical, and then later down he had to go back to J1 research, but they didn't approve of it, and he had to go back to Pakistan and he had to restart his training. So it can become tricky because with the J1 visa you have to do 2 years of waiver, and when you switch from J1 research to J1 clinical, your visa might get rejected, and if it doesn't get rejected, then the waiver part becomes a bit more complicated for these research positions. But yes, they are like easily available, and because a lot of places they're doing a lot of research and they do need like somebody to run the results, or they need somebody to do the data entry or something like that, especially in like all the um, research centers in the US. But if you want to pursue residency eventually, and I want I think advice based on my like personal experience or my friends who had like this same issue. I know there was one of Shifa's senior. I think he had the same issue with J1 research and J1 clinical transition. The other thing is on J1 visa, you can only be doing training for 7 years. And for H1, you can do training for 6 years. So if you come on J1 research and you do 1 year of research, and then you only have like 6 years remaining for residency and fellowship. Some fellowships, such as like cardio, gastroenterology, you might end up doing a chief year in between in some institutions. So you might already be reaching the limit. So that's something to keep an idea about before you sign J1 research, that all the J1 visa, they come with 2 years or 3 years of waiver, and sometimes you're not able to do waiver because you haven't done residency. If that answers the question. So you don't for these positions, as long as you apply to them and you tell them that you will be committed, and you'll like you have to write like one letter of intent, or I might say like personal statement. And once you like write the personal statement, you tell them that you're willing to, like, if you are very passionate about the field of research and you want to do it, you should be able to get it. Um, let's see. I think narrative review without as medical student might be hard, because technically narrative reviews are like clinical experts' opinion, using different like research on that topic, and then the person who is writing the review will give his own clinical opinion based on his own experience. So it might be hard to write a review article alone as a medical student. You might need like a supervising physician. Um, I know all of my articles which I wrote as medical student, there was always a supervising physician or attending at that time, and it makes the review process easy. Especially like, for example, if you submit your review article to like Journal of Endocrinology, they would like an endocrinologist to be on board so that they're able to give their expert opinion. Okay. Any other question you guys have regarding this? Um, so, so this is something like, this is like a new topic, AI feedback. I think it just came recently. I know like ACG, when we are submitting our articles and everything, and I recently submitted an article for this like GLP agonist. They did ask me that AI was not used for writing the paper, and did say yes. So right now they don't permit AI to modify your paper or anything like that, and you also have to do like a disclosure to say that AI was not used in writing this paper. Um, there's a conference coming up in October, and one of my abstract was accepted, and even asked me that the presentation I'm going to make, did I use AI or not? So right now you have to give credit to AI, but I think journals are still thinking if they're going to accept AI or not. So I would avoid using AI. You can use AI to get an idea about that like article you want to write on, but at the end of the day, use your own words, because whatever AI writes, they will be able to easily identify if AI wrote it or you wrote it. So if like a program director selects a student for like a research, I think the main thing they're looking for is like the personal statement or the letter of intent regarding that position or a cover letter. I think that is the most important thing they look for. And they also look for if the student is able to commit to them that, okay, they will be doing that research for 1 year. That's based on one of my friends' experience. He did 1 year of research in a neurosurgery lab in University of Pennsylvania. And these were the two things basically look for it. Was he able to commit 1 year to them? Was he going to be punctual? And how motivated was he in doing the research? He didn't have any prior publication and he didn't have any prior research experience. And he was able to get that job pretty easily. And UPenn is like, I think it was one of the most like competitive university, I think, in the US, and comes under Ivy League as well. So I think the main thing they're looking for is your dedication and your willingness to do 1 year with them at least. Some of them might require you to do 2 years, but most of them at least require 1 year. Okay. Let's see if I miss any questions. For guidelines for gastroenterology, it was ACG. For internal medicine, it's ACP. And I know for cardiology, it's ACC. And then pulmonology, we have CHEST. Having more reference in the paper does not increase the chance of publication per se, but in general, like if you're writing a review article and it's very detailed, you automatically will have like more references, but it's not necessary. I know some of my like review articles, they have like 100+ references, and some of them they are like published in a much better journal and they have like 60 references. So the reference itself is not important. The important part is how well you address the topic, and then adding tables and figures, I think personally makes a much bigger difference. And I will email you the guys the slide from the presentation, and you guys can use it. So, do you need a published author on board to write a clinical review? No, not necessarily. Like I know some of my initial reviews I wrote with some of them, like none of us had any published articles, and it did take some time for them to get accepted, but it's not necessary. As long as you have an expert in that field, it should be okay. So abstract basically and systemic review. So each time you write any article, it could be an abstract, case report, case series, randomized controlled trial. The abstract is like the summary of that article. There is a structure abstract and unstructured abstract. Structure abstract basically has introduction, methodology, discussion, and conclusion. Some journals want you to write an unstructured abstract, so it doesn't have any heading, but it covers the same thing. All articles have to have an abstract if they're getting accepted in a journal. So that's the difference. Sometimes you might say that, like later on when you guys are applying for like residency, or even like if you're applying for residency back home or UK or in any other country, sometimes people in the CV mention that they had like 7 abstracts or 10 abstracts. So sometimes it's very hard to complete a paper in time. So a lot of people, what they do is they write an abstract, they submit it to a conference, and then it's counted as like an abstract publication. But all systemic review, meta-analysis, or any kind of article will have a abstract. You guys will have to write. An abstract can be from 250 to 300 words. Okay, let's see. So I'm not sure if you got a paid research position or not. I can ask him, but I'm not so sure if you got paid or not. I know most of them are unpaid, and some of them they are officially unpaid, but they give you a stipend or something like that. And so the publication, I think takes time. It took me a lot of time. I know my first publication got accepted somewhere in like third or fourth year of medical school, and then publication can be hard, but at the end of the day, I think once you get one article accepted, I think it gets easy to write subsequent articles. And the number, I think in the end, long run, it doesn't really matter. But I think the main thing is if you write, even if you write one good article and it gets a lot of citation, for me, it was like the Ebola virus. Um, it makes a big difference for future publication. And then once you've gone to the peer review process for one of the article, you will know not to make the same mistakes in the future. And as long as you guys are trying, and you will start getting publication, and the number will increase with time. And I'm sure, like based on like the reviews and the answers to the questions I got from the practice session, I think all of you guys are like very motivated and very dedicated, and you guys have like a much clear thought of how to write a review article as compared to me when I was a medical student. So you guys have done like really good. And yeah, so if you have a solution to a problem, they are more likely to get accepted. I think the Ebola virus, the reason it got accepted to BMC, I think the main reason was because we were addressing the community factors which different communities played in order to prevent the spread of Ebola. So it got accepted. So yeah, solution to the problem, review articles, they are much accepted. So I know like Pan African, I think it's one of the PubMed Index journal. One of my initial articles, it went there. JPMB is also like PubMed Index. It does have like an impact factor of 1.0. The only thing is they take like 5 to 6 months to get published, but it's also PubMed. Curious is a much easier journal. Sometimes I just like if I'm free and I'm writing like a quick clinical review, I just submit it to Curious. They have a very fast process. The only thing is, I think for medical student it's free. They didn't used to charge us anything. So that's also good American journal. And their review process is pretty fast. So these three I know on top of my head, and then I think once you publish at one journal, if one of your supervisors is getting an invited review, they are more likely to be published as compared to uninvited reviews. So you can start getting like higher impact journals later on down in your career. But I think these three journals are good journals to start with. There's some Turkish medical journal as well. Their process is also pretty simple, so you can try that too. And then I think the best.
So please, can you repeat the first journal that you named?
Pan African Medical Journal. I submitted one of our articles which got published here. It's a good index journal. And JPMA, Curious, Turkish Medical Journal, and I think each year they keep coming up with like new journals which you guys can try if they're PubMed. And the new journals, they are like their selection criteria is much easier than the old journals. Okay. And, does anybody else has any question? Okay, one more. Yes, sure, sir. I will email my presentation so you guys can share my email ID, and then you guys can email me as well. Okay. Anybody has any other question?
Sir, some of the participants are requesting for your email.
And let me actually just type it here.
Yes. Thank you, sir.
No problem. Okay, so I mentioned my email ID in the chat, and so for the topics, I think as long as you like, for example, if there's like any other epidemic or endemic going on, I think you guys can easily write a review article. They always will have like less review article on that topic. You guys did mention a lot of like topics on the practice session which did, and all of them were like pretty good. So you guys can write a review article on any of those topics as well. But once you select the topic, I think I would say is to go over the PubMed to make sure like what literature is available on that and what's lacking, and then you want to address what's lacking in that. And sometimes it's not necessary that, for example, if you're writing an article on a disease which is more prevalent in male, you can maybe focus on like the effect of that disease on females and see how the disease progress and everything. So um, the topic you guys can choose whichever you think is like the literature is lacking, anything which comes up. Like sometimes when you guys are doing your medical rotation, you might see like unique diseases, or you might see that, okay, this disease is increasing in prevalence. And then you can just write a review article on that as well. But before starting a review article, I think just make sure there's not a lot of review article on that topic, and you can take it from there. Nowadays, I mostly write like invited review. So the channel basically just email us the topic, and then I write it on that. Invited reviews are kind of different than uninvited review articles. But before that, when I was medical student, even during like part of my residency, as long as the review article you choose, and I think all of the topics you guys suggested, they're all really good, and I think all of you guys can write review articles on that. Just make sure the point you're addressing has not been addressed that much in other papers. And then, like, you guys are like really good mentor, Dr. Saita. I did a lot of my initial research with her, and I think all of our papers were published as well in like different journals. We didn't stick to one journal at that time. So she's also really good, and she really gives good feedback. And I think I started doing more research during my community medicine rotation during the 4th year. I did one like original project with Dr. Ashraf. I think we got like 3-4 papers out of it, stress in medical student. That was my introduction to the research. And then Dr. Ashraf also helped me a lot as well. And he also has like good experience. So these two, and then Dr. Ume Kulsum, I also worked with her as well during my community medicine rotation. Dr. Ali used to be there as well, and he helped me a lot too. So you guys do have a lot of good like physicians and faculty members who will be able to help you as well. We can focus on community medicine topics, and I think community medicine topics, they are more like patient-oriented medical reviews, and I think you might be able to get them published much faster. All my initial reviews are basically community medicine. Like I wrote a review article on rotavirus vaccine, Ebola virus, Zika virus, and then but all of them are basically focused on the community medicine aspect. Medical topics, they are much harder to write because you need to have an expertise regarding in-depth knowledge of different medications available, and then trying to like focus on the different randomized control trials, everything. It can be a bit of an uphill task. So I would recommend starting with community medicine topics and then take it from there. And you guys have like really good community exposure as well. So you can always like come up with solutions from your own community exposure, and then you can apply it in different situations or different disease altogether. And you guys can write article on any vaccine as well, like which is limited literature. When I was medical student, there was not a lot of literature on rotavirus vaccine. You guys can write like review article on COVID vaccines and its implication. Or you can like any vaccine which are new, you can easily write a topic on that. But COVID vaccine, I think, is the most like there's a lot of controversy going on regarding COVID vaccine, so I think that will be a good topic to write on. And if you're going to submit to JPMA, just include Pakistan aspect of that vaccine, and JPMA usually do accept articles. It might take like 4 to 6 months, but they do accept in my experience. And it's PubMed. Once you get your name on PubMed, then other international journals are more likely to accept your articles. And JPM is not very expensive either, as far as I know. And then, but if you're starting from first year, then like you will have 5 years to improve your research skills, so that makes a big difference. And if you guys are like in first, second, third year, and over these 3 years, you will still have some time to do other stuff as well, and you won't have to focus on your final props and then applying for like steps or UK or like Pakistani examinations or any other country examinations. So the first 3 years, you guys can also like start in original like research, and the original research, it doesn't have to be pure medicine. It can be just a survey on patients. You guys can do like an original research on like reason of uncontrolled diabetes in patients presenting to endocrinology clinic, or you can do some research regarding the awareness of some certain aspect in different patient population, or you can do research on like one of our research was basically dental hygiene in medical students. So you guys can do a lot of medical education topic as well. And if you start your research in first year, you will like by third and fourth year, you will have all the data available, and you will would have published 1 or 2 original articles. Original articles, they are much easier to publish than clinical review articles, and because you have your own results and you have written a methodology, so it's much easier. The only advice I would give if you're writing an original article is if you can get a validated questionnaire, then your chances of getting publication is 10 times more than a questionnaire you constructed yourself. So if you can find a validated questionnaire, so for example, if you want to look at quality of life of patient and diabetes, and you use a proper quality of life questionnaire which is available by WHO, you will more likely to get it accepted as compared to a quality of life questionnaire you guys create yourself. If you can use a validated questionnaire for at least certain aspect of that study, then you guys will get accepted will be much easier. That was my experience. But it's really good if you guys are starting at first and second year medical students. That's like amazing. Okay, sounds good. So if you guys have any more questions, you guys can email me as well. And thank you so much for your time. And I hope you guys have a nice evening, and best of luck for tomorrow.
Thank you so much, sir, for your time.
Thank you.